Today was also all about an opportunity to come together with like-minded colleagues from the university, from other universities and from clinical practice as well, as a community of practice to discuss experiential learning, simulation learning and interprofessional education, and then importantly how to influence the students' experience and the students' learning for the benefit of patients at the end of the day.
The good thing about all the simulated practice learning that I've seen that works well is it is co-produced and authenticated by patients, by people who use our services and their carers. And that makes a huge difference. And we are seeing simulated practice happening in universities, in colleges and in practice settings.
Today was really a really good exploration of where Northumbria are at with regard to their simulated practice and simulated practice learning, which was something I really valued attending because this area is moving so quickly. Simulated practice and AI is moving so quickly.
So simulation is a key ingredient, a key element of improving CFD. Just getting good at things, practicing.
So it's good to see what's happening here in the Northeast, and it was good to bring some of the ideas that I've seen from other places and just to enjoy listening to all the innovation and creativity here.
My key takeaway from today has been that there is so much knowledge out there and people, I think, are really keen to share that knowledge. I think that it's be really interesting to see how people can take that next step where they do share knowledge and can kind of embed good practice into what they're doing really day to day moving forward.
I particularly enjoyed learning about the interprofessional education in simulated practice because clearly I'm a regulator of nurses and midwives, so it was great hearing about the other professions as well. But I think what I really did enjoy as well was that there is still that deep interest in research and development, and the outcomes like patient safety and clinical outcomes were really central to our aims in what we're doing in simulated practice to make sure that we've got nurses, midwives, medics, allied health professions who are really safe and effective in their practice.
Events like this are important. It's easy to get caught up in busy lives and getting on with sort of expectations of usual work, if you like. So it's really important as part of that overall work to have points in the calendar in the year where you can stop and think, reflect, evaluate and think about what else could we be doing better, differently, and celebrate what we do really well. So I think as an experience in our working lives, these collective events are very important just to keep the energy going around our specialist subjects, if you like.
So I think it's about making sure that people who are involved in education of future professionals are sharing knowledge, good practice, and are able to develop the workforce moving forward.
What are we learning from other areas that engage in simulation, like what's been learned in aviation? I mean, that was quite a thing for me to take away, to think outside the box and think further in terms of things like aviation.
And then finally, our friend AI, which I'm a moderate enthusiast for as well. Is it going to support us? Is it going to disrupt us healthily or otherwise? Or is it going to reinvent the paradigm of healthcare?
What's the one myth you quite often hear about simulation and its relationship to practice-based learning? Shall we start, Paula, and then?
I think the biggest myth that I go around and bust is I get fed up of hearing the NMC says you can't do this. And the NMC doesn't say you can't do any of it. In fact, that's why the standards are outcome focused, so that you can deliver practice learning in ways that are creative and innovative and different.
I think the biggest missed opportunity is the translation of the evidence into the field of patient skills and patient self-management. And so Graham talked about you're doing it with lawyers, you're doing it with bankers, you're doing it with historians. You do it with patients, the opportunity to empower them to manage their own conditions, to take demand off the NHS, to make them happier and more fulfilled with the way they're managing their lives is a massive opportunity that nobody's, as far as I'm aware, is really taking.
Northumbria University have a long history of delivering simulation and experiential learning and interprofessional education. But what we have done now is developed a real body of knowledge and expertise around this. There are the next generation of educators coming through to deliver this, and using more technology, the technological advances we can weave into the curriculum now. So, and also developing the research behind it as well.